The wind screamed across the savannah, driving sheets of rain against the clinic's tin roof with the fury of 1,000 drums. Dr. Sarachin rubbed her tired eyes and glanced at the clock nearly midnight. She'd been cataloging medical supplies for hours. The monotonous work a welcome distraction from the storm's violence. Lightning fractured the sky beyond the windows, illuminating the acacia trees bent nearly horizontal against the gale. She was reaching for her cold coffee when she heard a sound that didn't belong to the storm. Scratching, deliberate and desperate, coming from the back door. Sarah froze, her heart quickening. Out here, 30 kilometers from the nearest town, unexpected visitors at night were rarely human. She moved carefully toward the sound, each step measured, and pressed her ear against the metal door. The scratching came again, weaker this time, followed by a low, guttural sound that resonated in her chest. Against every instinct screaming caution, Sarah unlocked the door and pulled it open. The wind nearly tore it from her grip, and rain lashed her face, but she barely noticed. There, collapsed on the concrete step, lay a lioness. The magnificent creature was soaked through, her tawny coat plastered dark against her sides. Sarah's medical training kicked in immediately. She saw the swollen belly, unmistakably pregnant, and the dark stain of blood mixing with rainwater beneath her hindquarters. But it was the lioness's eyes that stopped Sarah's breath. Amber and luminous even in the dim light, they locked onto Sarah's with an expression she'd seen countless times in her work, the universal language of a mother in crisis. The lioness made no move to rise, no threat display, no warning growl. She simply watched Sarah with an exhaustion so profound it transcended species. Her flanks heaved with labored breathing, and a tremor ran through her muscular frame. Sarah stood transfixed in the doorway, rain pouring over her shoulders, facing an impossible moment. This wild, powerful predator had chosen her door, her threshold, in what must have been her most vulnerable hour. The wind howled, but Sarah barely heard it anymore. She was calculating blood loss, term of pregnancy, stress levels, shock, and beneath all that clinical assessment ran a single, undeniable truth. This lioness was asking for help. The question now was whether Sarah could provide it. Sarah crouched slowly beside the lioness, her knees touching the wet concrete as rain continued to pour around them. She kept her movements deliberate and her voice low, a gentle murmur beneath the storm's roar. The lioness's breathing was too shallow, too rapid. Sarah's trained eye caught the sunken quality around her ribs, the way her tongue lulled slightly classic dehydration. And the blood, still seeping slowly, told a story Sarah had seen before in difficult births. She reached for her phone with trembling fingers, already knowing what the wildlife rescue coordinator would say. 2 hours minimum in this weather, maybe 3. The washed-out roads, the flooding, the distance. Sarah looked back at the lioness, watched another tremor shake her frame, and knew with absolute certainty that this magnificent creature didn't have 3 hours. The lioness hadn't moved except for the labored rise and fall of her sides. Her massive paws, capable of bringing down a buffalo, lay still on the threshold. She could have lunged, could have used what strength remained to defend herself from this strange human hovering so close. Instead, she simply watched Sarah with those exhausted amber eyes, a silent understanding passing between two mothers, one who had delivered countless lives, one trying desperately to deliver her own. Sarah made her decision. She propped the door wide open and moved into the clinic, flipping on the overhead lights in the surgical prep room. Her hands worked quickly, spreading thick blankets across the floor, pulling out IV supplies, obstetric equipment, anything she might need. All the while, she kept talking, her voice steady and reassuring, the same tone she used with frightened dogs and injured horses. When she returned to the doorway, the lioness was watching her. Sarah knelt again, close enough to feel the heat radiating from that powerful body despite the rain's chill. She extended her hand slowly, palm down, and waited. The lioness's nostrils flared, taking in Sarah's scent. Then, with effort that clearly cost her dearly, the great cat shifted slightly, as if trying to understand what was being asked. Sarah kept murmuring softly, words of encouragement and comfort and gradually began guiding the lioness inside. Each movement was a negotiation of trust, a conversation without words. The wild didn't often walk willingly into walls and lights, but tonight, in the space between desperation and hope, it did. Sarah's fingers moved gently across the lioness's swollen abdomen, feeling for the telltale positions she'd learned through years of veterinary work. The lioness flinched slightly but didn't pull away, her exhaustion overriding instinct. Sarah's heart sank as she felt what she'd feared the cub was breech, lodged at an angle that made natural delivery impossible. Without intervention, both mother and baby would be lost. She reached for her phone with shaking hands, scrolling to Dr. Okello's number. Her mentor answered on the second ring, his warm Kenyan accent immediately grounding her spiraling thoughts. Sarah explained the situation in rapid whispers, glancing frequently at the lioness as if the animal might understand and bolt. Doctor. Okello listened without interruption, then began walking her through the protocol with the calm precision that had guided Sarah through her most difficult cases. The sedation was the greatest risk. Too little, and the lioness would wake during the procedure, her protective instincts turning Sarah from helper to threat. Too much, and her compromised system might not recover. Sarah calculated dosages based on the lioness's weight, her dehydration levels, her weakened state. She drew the medication into the syringe, her hands steadier now with purpose. The lioness watched every movement. Her amber eyes tracked Sarah crossing the room, preparing the injection, kneeling beside her once more. There was something profound in that gaze, not the glazed vacancy of a dying animal, but an acute awareness that seemed to weigh Sarah's intentions. It reminded Sarah of the way her own patients sometimes looked at her, as if they could sense whether she meant them harm or healing. Sarah spoke softly as she administered the sedative, the same gentle murmur she'd maintained since opening that door. She told the lioness she was safe, that help was coming, that her babies would be okay. Ridiculous, perhaps, to narrate comfort to a wild predator. But Sarah had long ago learned that tone mattered more than words. The lioness's breathing began to slow, her massive head lowering gradually to rest on her outstretched paws. Dr. Okello's voice continued through the phone speaker, methodical and encouraging. Sarah laid out her instruments, with practiced efficiency scalpels, clamps, sutures, all arranged within easy reach. The storm still raged outside, but inside this small clinic, illuminated by harsh fluorescent lights, a different kind of intensity had taken hold. Sarah took a deep breath, placed her hand on the lioness's quiet flank, and began. Sarah's world narrowed to the rhythm of the lioness's breathing and the delicate work beneath her hands. She moved with careful precision, feeling for the cub's tiny limbs, understanding through touch what her eyes couldn't see. Doctor. Okello's voice guided her through the phone, but Sarah's instincts led the way, years of delivering calves and foals translating into this moment, with a species she'd only ever admired from a distance. The cub was smaller than she'd expected, impossibly fragile for something that would one day grow into an apex predator. Sarah gently maneuvered the tiny body, coaxing it into the correct position with movements that felt more like prayer than procedure. The lioness's breathing had steadied under sedation, the dangerous shallow panting replaced by deeper, more measured breaths. Sarah checked her pulse frequently, one hand on the mother's chest while the other worked to save her baby. Then, finally, she felt the shift. The cub moved into alignment, and Sarah's heart leaped as she guided him carefully through the birth canal. He emerged small and dark, his fur slicked wet, his eyes sealed shut. For one terrible moment, he lay utterly still in Sarah's hands, and she felt a familiar grief rising in her chest, the devastating weight of arriving too late. But then his tiny ribcage expanded, a shallow breath, then another. Sarah grabbed the softest towel she had, wrapping him quickly and rubbing gently to stimulate circulation and warmth. The cub made a sound, barely more than a squeak, but it was life asserting itself. Sarah blinked back tears she hadn't realized were forming. She placed the cub in a nest of blankets beneath a heating lamp, her eyes scanning his small form for signs of distress. His breathing was weak but steady, his miniature paws flexing slightly as warmth began to seep back into his body. He was perhaps the size of a house cat, tawny and perfect and impossibly vulnerable. Sarah turned back to the lioness, checking her vitals with renewed focus. The mother's heartbeat was stronger now, more regular. Her sides rose and fell with a steadier rhythm. Sarah placed her hand gently on the lioness's flank, feeling the warmth of her, the powerful life force that had trusted a stranger in her darkest hour. There might be more cubs. Sarah would be ready. For now, one small life had been pulled back from the edge, and that felt like everything. The second cub arrived 20 minutes later, sliding into Sarah's waiting hands with less resistance than her brother. She was smaller, her coat a shade lighter, and she mewed immediately upon contact with the air, a tiny, indignant sound that made Sarah smile despite her exhaustion. The third cub, another male, followed 40 minutes after that, his arrival almost gentle compared to the first struggle. He was the smallest of the three, concerningly so, but his lungs worked and his heart beat steadily beneath Sarah's stethoscope. Sarah weighed each cub carefully, recording numbers that confirmed what she'd suspected. They were all underweight, likely the result of their mother's prolonged stress and dehydration. But they were breathing, moving, very much alive. She kept them warm and dry, watching for any signs of distress as the storm outside finally began to quiet. The sedation was wearing off gradually, just as Dr. Okello had predicted. Sarah noticed the change in the lioness's breathing first, the shift from the deep unconsciousness of medication to the lighter rhythm of natural sleep. Then came the small movements, a twitch of her ear, the flex of her massive paws. Sarah positioned the three cubs carefully near their mother's belly, close enough that the lioness would find them immediately upon waking. She stepped back, giving them space, her heart pounding with an anxiety she hadn't allowed herself to feel during the medical crisis. This was the moment of truth. Would the lioness accept these cubs she'd never consciously delivered? Would her instincts recognize them as her own? The lioness's eyes opened slowly, unfocused at first, then sharpening with awareness. Her head lifted slightly, and Sarah held her breath. The great cat's nostrils flared, taking in the sense of the clinic, of Sarah, and then most importantly of the three small bodies nestled against her. A low rumble emanated from deep in the lioness's chest, not a growl but something softer, more primal. She lowered her massive head toward the cubs, and her rough pink tongue emerged to begin cleaning them with long, deliberate strokes. The first cub squirmed under the attention, his tiny mouth opening in a silent cry. The female nuzzled closer to warmth. The smallest male simply lay still, accepting his mother's ministrations with what seemed like relief. Sarah felt something break loose in her chest, tension she'd been holding for hours finally releasing. The lioness was mothering her babies, claiming them, loving them in the ancient way of her species. The first 72 hours blurred into a rhythm of watchful vigilance. Sarah slept in the clinic's office, setting alarms every 2 hours to check on her unusual patients. Each time she entered the prep room, she moved slowly, announcing her presence with soft words and deliberate footsteps. The lioness would lift her head, amber eyes tracking Sarah's movements, but made no move to defend or attack. It was a delicate equilibrium, this sharing of space between wild and human. The cubs nursed constantly, their tiny bodies latched onto their mother with fierce determination. The lioness, despite her own depleted state, curved her body protectively around them, offering what nourishment she could. Sarah watched this sacrifice with a veterinarian's clinical eye and a woman's deep admiration. She knew the lioness was burning through reserves she didn't have, giving everything to these three small lives. Sarah brought fresh meat from the cold storage cuts intended for the larger animals she sometimes treated. She placed the food just within the lioness's reach, then retreated to sit cross-legged against the far wall. The lioness waited, always waited, until Sarah was settled and still before eating. There was a protocol to their interactions now, an unspoken language of respect. Sarah understood she wasn't welcome closer, but she wasn't being driven away either. The water was easier. Sarah refilled a large metal bowl twice daily, and the lioness drank deeply each time, her pink tongue creating small waves across the surface. Hydration brought clarity back to her eyes, strength returning gradually to her magnificent frame. Sarah documented every meal, every nursing session, every small improvement in meticulous notes that Dr. Okello reviewed during their daily phone calls. By the third evening, something subtle had shifted. The lioness no longer tensed when Sarah entered. She would glance up, assess, then return her attention to her cubs without the hypervigilance of those first hours. Sarah found herself talking to her sometimes, narrating her actions in that same gentle murmur she'd used the night of the storm. She wasn't foolish enough to think they were friends. This was a wild predator tolerating a human presence out of necessity and perhaps something deeper. But there was understanding between them now. Two mothers, separated by species and instinct, connected by the universal truth that some things matter more than fear. The cubs squeaked and squirmed, the lioness cleaned and nursed them, and Sarah kept watch over them all. The transformation happened in small increments that accumulated into something remarkable. The cubs, still blind and helpless, had grown noticeably plumper, their tiny bellies round with milk. They nursed with increasing vigor, kneading their mother's belly with paws that would someday be powerful weapons, but were now just soft padding seeking comfort. Their squeaks had grown louder, more insistent, filling the clinic with sounds that seemed impossibly vulnerable for creatures born of such strength. The lioness's wounds had closed cleanly, the bleeding that had marked her arrival now just a memory recorded in Sarah's notes. Her coat had regained its luster, no longer the dull, rain-soaked mess of that first desperate night. She moved with more confidence now, adjusting her position to accommodate her nursing cubs, stretching her powerful limbs during the rare moments when all three were sleeping. Sarah could see muscle definition returning, the hollowness around her ribs filling out with each meal consumed. But it was the grooming that captivated Sarah most. The lioness would spend long periods cleaning her cubs with methodical devotion, her rough tongue working over their small bodies in long, purposeful strokes. She started at their heads, cleaning behind their sealed eyes with remarkable gentleness, then worked down their backs, their legs, their tiny tails. The cubs would squirm and protest, but their mother was relentless in her care, turning them with her massive paw to ensure every inch was attended to. Sarah found herself mesmerized by these moments, often forgetting to write in her notes as she simply watched. There was such tenderness in the way this apex predator handled her babies, such fierce protectiveness mixed with surprising delicacy. When the smallest cub would roll away from his siblings, the lioness would gently nose him back into the warmth of the group. When the female cub mewled in distress, her mother would immediately shift position, offering better access for nursing. This was wildlife behavior Sarah had only read about in textbooks or glimpsed briefly through binoculars from a safe distance. To witness it here, in her small rural clinic under fluorescent lights, felt like a privilege she couldn't quite articulate. The lioness had brought her wildness into Sarah's human space, and rather than diminishing it, the contrast somehow made it more profound. These were moments belonging to the savannah, to hidden dens and ancient instincts, now unfolding on donated blankets in a room that smelled of antiseptic and hope. Dr. Okello arrived at dawn, his experienced eyes taking in the scene with quiet approval. He examined the lioness with practiced hands, while Sarah kept a respectful distance, ready to intervene if needed. But the great cat allowed the examination with the same cautious tolerance she'd shown Sarah, as if she understood this was another part of the strange ritual that had saved her life. Dr. Okello listened to her heart, checked her healing wounds, observed her interaction with the cubs. When he finally stood and nodded, Sarah felt her chest tighten with an emotion she'd been avoiding for days. The lioness was ready. Her body had healed, her strength had returned, and her cubs were thriving. There was no medical reason to keep them longer. Dr. Okello spoke gently about release protocols, about finding the right location away from competing prides, about giving them the best chance at reintegration. Sarah listened and took notes, her professional demeanor firmly in place, even as something deeper ached beneath the surface. That evening, after Dr. Okello had left with promises to coordinate with wildlife services, Sarah sat against the wall in her usual spot. The clinic was quiet except for the soft sounds of the cubs nursing, their contented squeaks, and the rhythmic breathing of their mother. The lioness watched Sarah with those amber eyes, and Sarah wondered what, if anything, this wild creature understood about their time together. She studied the cubs with deliberate attention, wanting to memorize everything. The way the firstborn male's ear twitched when his sister bumped against him. How the smallest cub always positioned himself closest to his mother's heartbeat. The delicate pink of their paw pads, still so soft and untested. Their tiny claws, retracted now in contentment, kneading rhythmically against their mother's belly in that ancient feline gesture of security and love. The lioness groomed them as Sarah watched, her rough tongue working with the same devoted tenderness Sarah had observed for days. This family would return to the savannah, to the life they were meant for, hunting under vast skies, teaching these cubs to be the magnificent predators nature intended. Sarah's clinic had been a way station, a brief sanctuary in a storm, nothing more. But sitting there in the quiet, watching three tiny lives nestle against their mother's warmth, Sarah knew she would carry this with her always. Some moments didn't need to last forever to matter completely. The sky was just beginning to blush with color when Sarah opened the back door for the last time. The air was cool and fresh, carrying the scent of wet earth from recent rains and the distant promise of acacia blossoms. The savannah stretched beyond the clinic in endless waves of golden grass, painted pink and orange by the emerging sun. It was the same door the lioness had collapsed against over a week ago. But everything had changed since that desperate night. The lioness stood immediately, her movements fluid and strong. She looked toward the open doorway, then back at her cubs, as if calculating the journey ahead. Sarah stepped aside, pressing herself against the doorframe to give the family room. Her throat felt tight, but she remained silent, not wanting to intrude on this moment with human sentiment. The lioness approached the first cub, the male who had fought so hard to enter the world. She lowered her magnificent head and gently grasped him by the scruff, lifting him with the same powerful jaws that could crush bone, but now held her baby with infinite care. The cub dangled peacefully, instinct telling him to go limp in his mother's grip. The lioness padded past Sarah and out into the dawn, carrying her son into the tall grass about 30 meters from the building. She placed him down carefully, nuzzling him once before returning. The female cub went next, squeaking softly as she was lifted, then falling into that same trusting stillness. Then the smallest male, so tiny in his mother's mouth that Sarah's heart clenched with worry she knew she had no right to feel anymore. Each time the lioness passed, Sarah caught the wild scent of her earth and grass, and something anciently feline that belonged to open spaces and starlit hunts. When all three cubs were safely deposited in the grass, the lioness returned to the doorway one final time. She stood on the threshold, this space between wild and human that she'd crossed out of desperation and was now leaving by choice. Her amber eyes found Sarah's, and for a long moment, they simply looked at each other. There was no gratitude in that gaze. Gratitude was a human concept. But there was acknowledgement, a recognition that passed between two beings who had shared something profound. Sarah felt tears she wouldn't let fall burning behind her eyes. The lioness held her gaze for 3 heartbeats more, then turned and walked back to her cubs, her tail the last thing to disappear into the golden grass. Sarah stood in the doorway long after the last ripple of movement had faded from the grass. The sun climbed higher, painting the savannah in shades of amber and gold that matched the lioness's eyes. Somewhere out there, hidden in that vast expanse, a mother was settling her cubs into a new den, beginning the ancient work of teaching them to survive in a world that was both beautiful and unforgiving. Sarah would never know where they went, and that felt right, somehow proper. She finally turned back into the clinic, and the emptiness struck her immediately. The prep room that had been filled with life and breath and the small sounds of nursing cubs now echoed with silence. The blankets lay rumpled where the lioness had rested, still holding the impression of her powerful body. The water bowl sat empty. The heating lamp, no longer needed, cast its warm glow on nothing. Sarah knelt beside the blankets, her knees touching the floor where she delivered 3 impossible lives. That's when she saw it, a small tuft of tawny fur caught in the blanket's weave. She picked it up carefully, rolling the soft strands between her fingers. It was coarse and fine at once, built for a life under the African sun, marked by the same golden hue, she'd watched disappear into the grass. She held the fur up to the morning light streaming through the open door, seeing how it caught the sun. This small piece was all that remained of the week that had changed everything and nothing. Her clinic would return to its normal rhythm, vaccinating cattle, treating injured dogs, the everyday work of a rural veterinarian. But Sarah knew she would never walk past that back door without remembering the storm, the scratching, the amber eyes meeting hers in desperate trust. The wild didn't often choose to trust humans. In Sarah's experience, it usually ran or fought, following the survival instincts written into every cell. But that lioness, in her moment of greatest vulnerability, had made a different choice. She'd collapsed on a human threshold and allowed a stranger to save not just her life, but the lives of her unborn cubs. Sarah closed her fingers gently around the tuft of fur, feeling its realness. It's proof that the impossible had happened here. For lives had walked out of this clinic into the dawn. Sometimes, she thought, the wild and the human could meet in the space between desperation and hope, and something beautiful could emerge. Sometimes trust was enough.